Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper left 6, 7, the lower left 6, 7, the upper right 6, and the lower right 6 and 7. Starting with the upper right 6, this is an endodontically treated tooth, as you can very clearly see. The MB1 is obturated, whereas the MB2 has been ignored, and we've got a MB2 missing, and we've got a periapical radiolucency associated with the MB2. Moving to the parietal aspect of this tooth, you've got a parietal root seems to be okay, even though we do see a slight bit of a instrument separation right here. And then we've got the upper left 6 distobuccal root, which is short on the CBCT. Moving to the upper right 7, the upper right 7 seems to be uneventful. We've got a little bit of a involvement of interradicular bone, so this definitely has periodontal problems. We can also see we don't see any periapical radiolucency, but there is severe bone loss, which is now affecting the interradicular area. We don't see any cracks in this tooth. Moving to the lower left 7, ladies and gentlemen, we've got periodontal disease there as well. Extreme bone loss, furcation is involved. We've got a large restoration, which does not cause any secondary caries as such, but we definitely have a lot of bone loss and periodontal bone loss. So hence, if this tooth is to be extracted, we've got an approximate ridge width of 7 millimeters with a ridge height of approximately 8 millimeters. Moving to the lower left 6 region, which is edentulous. Here we've got D2 quality bone, approximately 9 millimeters of ridge width with a good 13 millimeters of height. So hence an implant placement here should be easy. Moving to the upper right 6, the upper right 6 has a class 5 lesion, has a class 1 lesion as well, and we can see that someone has tried to do a restoration here, but that has been drilled out. We've got a slight bit of a root fracture in the upper right distobuccal root. So the distobuccal root shows a horizontal fracture, which is very interesting. You can see right here, this part here, and then we've got fracation involvement, we've got root involvement. So hence this tooth definitely is not doing well periodontally or restoratively. This here is the mesiobuccal root, again insane class 5 lesion, and we've got MB1, MB2 both, and we've got furcation involvement. Should this tooth be extracted, we have absolutely no bone for implant placement, and hence a sinus lifting will need to be done. 12 millimeters of ridge width, but unfortunately only 3 millimeters of bone height in the interradicular area. Moving to the lower right 6, this has a large restoration. This is the MB. This is the mesial canal. We've got 2 canals joining to form one at the apex. You've got a slight bit of a radiolucency in the mesial root. Moving to the distal root, we've got a class 5 lesion here as well. But we've got a solitude singular distal root, which starts as very wide, and then there's a wide distal root at the apex as well. Moving to the lower right 7, the lower right 7 is also periodontally compromised. This is the interradicular bone. The lower right 7, ladies and gentlemen, is periodontally compromised. You've got severe bone loss, 2 canals in the mesials, and then we've got one canal in the distal right here. The furcation in this tooth is also involved because of periodontal disease. Should this tooth be extracted, we don't see any periapical radiolucencies or any cracks, but yes, severely resorbed roots because of the periodontal compromised periodontium. Moving to the axial view, this is the axial view of the left hand side, and this is the axial view of the right hand side. Very clearly you can see the 6 and 7, the furcation is involved right here in the 7. Moving further down, we've got one wide canal in the mesial, which starts as 2, but then becomes one wide canal in the mesial, no separation of the 2 canals, slightly rotated tooth, and one single canal. At the apex, you can see it actually separates into 2 distinct canals. So it's a 1-2 configuration in the mesials of the 7 and a singular canal in the lower right 7. Thank you very much.